Hi everyone, it's Sonia. So in this video, I want to talk about sciatica, sciatic pain, sciatic nerve, SI joint dysfunction. So you go to a doctor to get diagnosed. I'm not a doctor. So some people want to go to a doctor, they get diagnosed. Some people would just want to come to me either because I already see them or they think it's muscular. It's your comfort. So I'm talking about the muscular side of it. So I want to show you some exercises, but the honest thing is, you're probably not going to do them right unless you know the bigger picture of what you're going to do, because if you just keep doing the same thing that you've always done with the same muscles in the same way, your pattern's not going to change. And so it's usually not just a one site issue, it's how all of the muscles are working together. So we have to talk a little bit about anatomy. We have your spine, and then what connects to the spine is the pelvis. The joint that they meet at, there's one on each side because the spine goes here, the pelvis is around, that's termed the SI joint because of where it connects. There is where a lot of nerves come. So if your pelvis is in one position and your spine's in a different position and your back doesn't like that, it's gonna cause you nerves to tell you. So where you're feeling the pain isn't necessarily where the problem is, and it's not necessarily where the problem is. So I know some people get a hard ball, like a lacrosse ball. I've heard of all sorts of things, golf balls, and they get into exactly where the nerve is bothering them. Now that could be one mode of thought, but to me, I feel like that nerve is already irritated. Why are we gonna go in there with something really harsh to make it possibly even more inflamed and more angry? Now, I have done this before, and there is a time and a place, but you need to know what's actually where the knot's coming from, because it's probably coming from somewhere else, not where you're feeling the pain. So, for example, if you squeeze your butt too much and you do this tuck under, then what you're doing is changing the pelvis, and right where the SI joint is, those two dimples, that's where the problem is. But then where do you feel it referred? Down the butt, down the leg. Some people have it come across, some people have it come up a little bit more. So the first thing I would do is working with someone is I need to kind of check out what's happening with their pelvis and their spine. So if your legs turn out, and I've done a video of this, turned out, and I'm splayed out, my gut's kind of hanging forward here, this is probably like a 90+% of where most people stand in general, but it's also where a lot of SI, sciatica, whatever that term is, stands. So we could have your legs come more parallel. We could teach you how to have more neutral of a pelvis, but the thing is it's not just a postural change, it's also in what muscles you use. So in that splayed out, relaxed position, you might be tightening your psoas, which is also not an abdominal muscle. It actually is what makes us be upright. So we don't want to be in that too much, because then it comes and connects here to the part of our back. So the first thing I need to see is, how does someone breathe? If they're breathing up like I've shown the videos for before, well, look at this. It's creating back movement. If this isn't stable and this is what I'm doing, but broken down on a smaller scale, when I breathe, then guess what? If this is still, then what's happening with my pelvis? What's happening when I walk? What's happening when I run? What's happening when we don't pay attention? It's such a bigger picture that needs to be paid attention to. So, having your legs be parallel. Do you sit on your tailbone more? So you have both sit bones. You want to sit on top of your sit bone. So that might be more between the pubic bone and tailbone. All of us have different sized bones, and so you need to figure out your neutral. It's hard to tell everyone through video. So you take a breath in through the side breath, the diaphragm, and then exhale. This is step one. So then, if I were to do an inner thigh exercise, so I'm just gonna have a ball here, and I inhale, and then on the exhale, I push in on the ball. What most people tend to do is pull from their lower abdominals, and see how my lower back tilts back? Well, that hurts my SI joint right there when I do that. So you wanna have a stable pelvis, stable rib cage, and then when you push in, you wanna try to work your pelvic floor versus just your inner thighs. Most people are used to the feedback of what muscles do for us. So I feel my inner thighs on, I feel my inner thighs off. I feel my abdominals on, I feel them off. I feel my butt squeeze on, I feel them off. all of those are more superficial muscles. So when we're talking about the core and trying to use it to correct us, we actually have to learn how to use different muscles. So you might be in this unknown place. You might be this unsure place because you for sure know the wrong muscles, right? We need to learn how to work the muscles that we don't know how to work better, but they're not in all or nothing. Like they don't have such a strong feedback. So if the sit bones come in towards each other and the hip bones lift up, but then it integrates nicely into stabilization here and people are breathing, then that's what tells me when they're in the right place. If I just on, off, and I have all this movement here, then that's going to be the wrong layer of muscle, and it might hurt you. This is what the pain is telling you. So, also, the other thing that needs to be strengthened is your side glute. A lot of people think the butt's great, so they do the glute maximus, which is true, but actually when we walk, we need the stability of our side glutes to hold us. Otherwise, we do hiking like this, and then that can also impinge the SI joint. So then if you were to come and lie down on your side, and bottom rib is lifted, then lift the leg up. I don't want to see any change here. Some people hike up here. See how my shirt wrinkles? My heel is up, my toe is down. So see that? That's more of a parallel, the outside of the edge of the foot lift and lower. And I want to think of working from my side glute. Most people turn out and have the toe lift and they go into their quad, and that doesn't do anything corrective. That actually just goes into a bad habit. So some people need their legs forward more in order to work the glute medius and minimus a little bit more. Some people already have too strong of glutes and then need to learn how to release it with the Yamana ball. So the softer balls can release the muscle at the glute especially in order to make it relax. A lot of people are way too strong in their quads, the front of the leg, and way too strong in their glutes because they're not strong in their pelvic floor, and there's some reason why they're compensating, whether it's conscious or unconscious. So being aware of what it feels like to have the glutes relaxed off, so then you can gently work the pelvic floor on, then that's going to be setting you up to have better stabilizing before mobilizing. Most people are all over the place when they go and move, where you actually should be supporting the spine and then moving from the legs, but then you can start to progress it to have a lot of spine movement in the right timing and order to have leg movement. So it's a much bigger picture and so hard to talk about in such a short amount of time, but this should be kind of just a little tidbit into what you can do to start to help your sciatic nerve, take it out of it so you don't have sciatica, SI joint dysfunction, and all of this stuff. If you have any other questions, you can always private message me, and I don't mind doing a video. I don't shout out to people, but I want to show that people, there's a bigger picture, there's a lot of hope, and there's something you can do, and that's why I'm so passionate about this, is because I live with these pains too, and it's usually from my experience that I've then gone into the inquiry to figure out what to do to try to help people have insight, know what to do, how to manage it, how to cope, all of that. So hope you have a good day and hope this helps. If it does, if you could just send me like a heart or a like, because I just like to know who I help or not, because then I'll just keep making more videos. Thanks everyone.